Developmental psychology explores how all of us grow across the phases of our lives, from conception through infancy, childhood, adolescence, and adulthood. These changes result from both nature, our genetics and biology, and nurture, the environment around us. Together, nature and nurture influence growth in three developmental areas: physical, socio-emotional, and cognitive. Figure 4.1. More information. Figure 4.1. Interactions between three areas of development. Humans develop in three areas: physical, socio-emotional, and cognitive. Change in each area affects and is affected by change in other areas. Physical changes involve shifts in hormone levels, growth of the body, and changes in the brain. Socio-emotional changes include changes in how we understand ourselves, interact with others, and experience and regulate emotions. Cognitive changes relate to how we think, reason, and communicate. These changes include how you function at school, so take time to review the impact strategy of improving in the learning to learn figure on page 137. Throughout life, nature and nurture influence our development in all three of these areas. You began life as just one cell in the uterus, also called the womb, and about 40 weeks later you were born. Human prenatal development is development that takes place before birth, and it includes three major periods of physical growth: the germinal period, the embryonic period, and the fetal period. Figure 4.2. More information. More information. More information. Figure 4.2. Prenatal development. A. In the germinal period, the union of egg and sperm forms a zygote that implants in the wall of the uterus by the end of 2 weeks. B. In the embryonic period, from the start of week 3 through week 8, the organs develop in the embryo. C. The fetal period, from the start of week 9 until birth, is a time of tremendous physical growth and brain development that prepares the baby to survive outside the womb. Germinal period. The germinal period begins with conception, when the sperm from the male unites with the egg from the female. This union creates the zygote, the first cell of a new life. The zygote begins to divide rapidly into 2 cells, then 4 cells, then 8 cells, and so on. Figure 4.2. Within 2 weeks after fertilization, implantation of the zygote occurs in the wall of the uterus, and the placenta begins to form in order to nourish the developing human. If any abnormalities occur during this earliest stage of development, the result is usually a miscarriage before the woman even knows she is pregnant. Embryonic period. From about the start of week 3 to the end of week 8, the developing human is known as an embryo. Figure 4.2b. The embryonic period is the most important time for physical development of the spinal cord, brain, and all internal organs, including the heart, lungs, liver, kidneys, and sex organs. Figure 4.3. If development goes wrong, birth defects may result, and miscarriage remains a threat. For example, if the mother has not consumed enough of the nutrient folic acid during the first month of prenatal development, then the embryo's spinal cord and brain may not develop properly. If the embryo then survives, the baby may be born with serious birth defects such as spina bifida, which includes an abnormally formed spine. For this reason, women who want to become pregnant are encouraged to eat foods such as spinach, broccoli, citrus fruits, beans, and avocados, which contain folic acid, or to take prenatal vitamins containing folic acid. Figure 4.4. More information. Figure 4.3. Physical changes in the 3 prenatal periods. A. The germinal period starts when the sperm meets the egg. Problems during this period usually result in miscarriage. B. The internal organs develop during the embryonic period, when differences in development may result in major or minor physical defects in bodily structures. C. In the fetal period, the organs start to function. Developmental differences in the fetal period are primarily related to minor physical defects and structures. Problems in physical development at any point in the prenatal period may result in psychological deficits after birth, during which period is the heart most susceptible to developing defects. Figure 4.4. The importance of folic acid. Nutritional deficiencies can cause serious birth defects. This mom-to-be is doing the right thing. Eating dark leafy greens, such as spinach, can help her baby's spine and brain develop. Fetal period. From the start of week 9 until birth, the growing human is called a fetus. Figure 4.2c. During this fetal period, no new structures develop, but birth defects remain possible, and miscarriage remains a threat through week 20. The fetus's whole body continues to change physically. Figure 4.3c. For example, at about 16 weeks the fetus begins to move its muscles. A first-time mother might feel these movements by about 20 weeks. The eyes and eyelids finish developing at 6 months. The organs also finish developing, allowing the infant, once it is born, to breathe on its own and digest the food it eats. In the last 12 weeks of prenatal growth, the fetus develops fat under its skin and increases dramatically in length and weight. While the fetus is growing larger, its brain also matures. The brain begins to process sensory input and motor output. Problems in physical development at any point during the prenatal period may affect psychological development after birth, possibly leading to deficits in cognitive, emotional, or social functioning. Most healthy full-term pregnancies end with the birth of the baby 38 to 42 weeks after conception. However, the fetus is thought to be fully developed and able to live outside of the womb at 28 weeks of gestation. Modern medical technology has made it possible for a fetus to live outside the womb much earlier in its development. About half of infants born at 25 weeks of gestation survive, and up to 10% of fetuses born at 22 weeks of gestation now survive outside the womb. For example, Amelia Sonia Taylor was born in 2006 after spending just 21 weeks and 6 days in the womb. Figure 4.5. A case of extreme prematurity. At birth, Amelia Sonia Taylor was a little longer than a ballpoint pen, and she weighed 10 ounces, less than the weight of a can of soda. Today she is a healthy child. We do not always know what causes premature birth, although it is likely that genetics, nutrition, and environment all play roles. Clear risk factors for premature birth are parental smoking, drinking, and drug use. Babies who are born prematurely have a greater risk of dying as infants. They also may have disabilities, such as cerebral palsy, breathing and feeding problems, and vision and hearing deficits. In addition, prematurity can have long-term effects on intellectual development, school performance, and even adult social relationships. Jansen et al., 2020, Wolk et al., 2019. But prematurity does not always lead to negative outcomes. After a rough start, baby Amelia, shown shortly after birth in figure 4.5, is now a healthy and successful child. Learning goal check. Review check your understanding. One of smoking, drugs, alcohol, and pollutants are just some of the substances that can make us sick. These substances can also harm developing humans. The same placenta that provides oxygen and nutrients to the baby helps protect it from harmful stimuli. Even so, some substances can pass through the placenta and sometimes have terrible consequences. Teratogens, from the Greek word tera, which means monster. Teratogens are substances that can harm prenatal development. Teratogens include many drugs, infections such as German measles and syphilis, and environmental factors such as X-rays and mercury. The impact of each teratogen depends on when exposure occurs, the amount of exposure, and how long it lasts during prenatal development. The physical impact of some teratogens can be obvious at birth. However, some teratogens have effects that are not apparent until the child is much older. These effects include disorders involving language, reasoning, attention, social behavior, and/or emotions. There are no standards about how much exposure to any teratogen is safe for healthy development. Even small exposure to some teratogens can have major effects. Although a woman's behavior before or during pregnancy can affect her baby, mothers are only half the story when it comes to prenatal development. Potential fathers, as well as mothers, must be cautious about their diets, exposure to toxins, and use of substances. It is now clear that a father's behaviors, including diet, toxin exposure, and amount of stress experienced, can affect prenatal development. Shagdarsharan and Steger, 2016. Saklenka et al., 2015. The take-home message here is that life experiences and environmental circumstances can be passed along in sperm as epigenetic information. Chen et al., 2016. These effects may then be passed along to subsequent generations. Drugs, including alcohol, are common teratogens. The use of drugs, such as nicotine, cannabis, cocaine, or opioids, during pregnancy can affect the mother and the developing child in the womb. Such substances can also affect long-term development during childhood and beyond. Unfortunately, surveys in the United States show that about 4.4% of pregnant women aged 15 to 44 years use recreational drugs. Benke and Smith, 2013. Though the actual percentage is likely much higher due to the increasing legalization of cannabis as well as the opioid epidemic. Rodriguez and Smith, 2019. Premature birth and other complications have been associated with the use of these drugs during pregnancy. Bayer et al., 2019. Huang et al., 2020. Among infants exposed to opioids in the womb, 40 to 80% show withdrawal symptoms as newborns. Yazdi et al., 2015. These symptoms include irritability, high-pitched crying, tremors, vomiting, diarrhea, and rapid breathing. The current opioid epidemic is associated with nearly 3 times as many infants born with this condition. Vocal, 2016. Babies born to women who are taking opioids, particularly methadone, are at 5 to 10 times greater risk than are other babies for sudden infant death syndrome. Ali et al., 2012. Maternal use of cannabis has been linked to impairments in the child's cognitive functioning and mental health. Bailey et al., 2020. Shire et al., 2019. For example, one recent study found that cannabis use by mothers during pregnancy, particularly when they continued to use the drug after they knew they were pregnant, was associated with more psychological problems for their children aged 9 to 11 years, including deficits in cognition and socio-emotional functioning. Paul et al., 2021. More information. Figure 4.6. Alcohol is a teratogen. Compare, left, the brain of a typical 6-week-old baby with, right, the seriously deformed brain of a baby of the same age with fetal alcohol syndrome, FAS. Both women and men can impair prenatal development with the most commonly used teratogen, alcohol. Women who drink alcohol when pregnant are gambling with their baby's development, because alcohol can lead to various defects. The most severe disorder is fetal alcohol syndrome, FAS, which results in abnormalities such as a small head, malformations of the face and limbs, heart defects, and abnormal brain development. Hoym et al., 2016. Figure 4.6. Besides these physical impairments, FAS babies often have a low birth weight, slight intellectual disabilities, and behavioral and cognitive problems. Guri, 2002. In the United States, about 1 in 8 unborn babies is exposed to alcohol and the risks associated with it. Olson et al., 2009. For this reason, many health workers recommend that women completely avoid drinking any alcohol when they are pregnant or trying to become pregnant. Mukherjee et al., 2005. Men might want to follow the same advice before and during efforts to conceive. Many children with fetal alcohol syndrome have fathers with alcohol use disorders. The father's excessive alcohol use may damage their sperm, thereby increasing the likelihood of FAS. Day et al., 2016. Figure 4.7. Zika virus is a teratogen. Prenatal exposure to Zika virus can produce major birth defects, such as microcephaly. Zika virus is a newer teratogen. In 2015, health experts raised concerns that Zika virus was causing birth defects throughout the Americas. Zika is spread mainly by infected mosquitoes, but it can also be transmitted via sexual activity. A pregnant woman may pass the virus onto her fetus, which can experience serious birth defects such as brain abnormalities and microcephaly, an abnormally small head often due to limited brain development. Christian et al., 2019. Rasmussen et al., 2016. Figure 4.7. Such defects are quite rare in normally developing babies. However, 6% of infants exposed to Zika have virus-related defects, particularly if they are exposed during the first trimester, when the brain is forming. Honing et al., 2017.